Hello, my name is Whitney Zahnd. I'm an assistant professor at the University of Iowa in the Department of Health Management and Policy and a member of the Holden Comprehensive Cancer Center. I'm going to be sharing a little bit of work on access to vaccine for children providers and how that might help increase HPV vaccination for rural children and adults. Some of the other presenters have shared some challenges we see with HPV-associated cancers and HPV vaccination in rural populations. Rural populations have higher HPV-associated cancer rates compared to urban. And we also see that trends are poor for rural areas. So some study that my colleague and I have done showed that cancer incidence rates, HPV-associated cancer incidence rates increased over 19% between 1995 and 2013, while urban rates remain stable. So we see this higher HPV-associated cancer burden, and we also see that rural populations have lower uptake of HPV vaccination. So you see this chart on the right from Walker and colleagues that thankfully across all populations, urban, suburban, and rural, that the rate of vaccination initiation has increased over time, but we still see that it's only 59.3% in mostly rural areas compared to 70% in urban areas. So what do we do about this to improve the initiation of HPV vaccination to subsequently help reduce the incidence of HPV-associated cancers in rural areas? So there's a couple recommendations that both the CDC and a commentary by Vanderpool, Stratman, and Brandt, Dr. Brandt, who's moderating this particular panel, have shown that some ways to improve vaccination rates in rural areas are, one, to reduce the out-of-pocket costs for this. And one way to do that is specifically the Vaccine for Children program from the CDC as kind of a little p policy approach to increase vaccination in rural communities. So this CDC program, as many of you are aware, is a way to provide vaccines for uninsured children and adolescents, or those who are underinsured, Medicaid eligible, or American Indian Alaska Native populations under the age of 19 for any of the vaccines that are recommended by the ACIP. And so that includes HPV vaccination. And so with that, one of the things that my colleagues and I did in a recent study in my previous institution, the University of South Carolina, we wanted to look at how accessible, from a spatial perspective, vaccine for children providers were in our state. So we obtained the vaccine for children provider locations throughout South Carolina and did some spatial analysis, considering both the location of those providers and so the supply of providers, supply of that particular healthcare service, and the demand for that service using the number of children under the age of 18 to create a spatial access score across zip codes in South Carolina. So you can see here on the map on the left, the areas in the garnet are the rural zip code tabulation areas, which is a geographic approximation for zip codes. And overlaid that are the locations of those VFC providers. And in the gray are the urban areas. Using the spatial method that we did, you can see the areas in the darker red are rural areas that have high access based upon that measure. And the darker blue are the urban areas with high access based upon that measure. And then the lighter colors of each, lighter hues or shades of each of those colors are areas where there's low access. So you can kind of see that here in the middle of the state as an example. So after that, just mapping those spatial access scores across zip codes, we did another spatial method which helps us identify statistically significant geographic clusters of different values. So the areas in red or pink are called hotspots, and those are areas where there's high access kind of geographically clustered. And we also overlaid that with, the cross-hatching here are the rural zip codes. And so you can see, for example, in this area that I'm circling right now, there's some rural areas that are hotspots for spatial access to vaccine for children providers. And we actually found there are more hotspots of access in rural areas. We also found, just looking at the mean spatial access scores across rural and urban areas, that the mean scores were higher in rural areas. So it's a little bit surprising, but this is also something that's good to see, that there's good access to these providers in rural areas. We also looked at this a little bit differently, not just by that spatial access score that it takes into consideration locations and the demand for the services provided at those locations, but also just simple distance. And we found there was no statistically significant difference in between the middle of each zip code to the nearest vaccine for children provider, whereas about 7.5 miles on average for rural zip codes and 6.5 miles to the nearest one in urban areas. We also looked at what types of clinics or providers were vaccine for children providers. And a key thing to note here is the plurality of rural providers were federally designated healthcare centers like FQHCs, rural health clinics, and other community health centers, as well as a larger percentage compared to urban that were at public health departments. Meanwhile, urban areas tended to have the majority of these clinics were at private clinics, or these providers were at private clinics. So I'm going to wrap up with just a few key takeaways from our study. One of the key things we found is that vaccine for children providers in the state of South Carolina are an accessible avenue for HPV vaccination among rural communities. We saw with the spatial access score that was actually higher across rural zip codes than urban. We saw similar average distances to the nearest VFC provider in rural zip codes compared to urban. We also demonstrated that spatial methods can help us identify areas where there's additional need for vaccine services. So using spatial approaches to describe the spatial access within an area, and using those clustering analyses to help us identify hot and cold spots that can be helpful for showing where there's additional need for those services. Also identifying where certain VFC providers are located and what types of providers those are can help us inform the planning and delivery of different interventions. So we found in rural South Carolina, the plurality of VFC providers were in federally designated health centers. And so there's really an opportunity to meet those rural patients where they are. About 1 in 5 rural patients get their care at FQHCs, for example, and many also get their care at rural health clinics. That's an opportunity to provide these vaccine services where patients are already seeking their care. It's also an opportunity to build upon the tremendous amount of resources that are being poured into rural health clinics and FQHCs for the COVID vaccine to go forward and use that momentum to help increase HPV vaccination in rural areas. So with that, I want to thank you all for your time and participation. I'm happy to take any questions during the panel, or please feel free to reach out to me if you have any further questions. My contact information is listed here. Thank you.